Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
About the crisis in Black youth. We talked about the crisis in Black people and the fact that Blacks were committing suicide twice as often as anybody else. But the data also unmasked that Black teenagers are doing the same thing, maybe even more than twice. And so Taraji Henson, who is the actress, she has depression, and she wants her child to have health care, and mental health care for teenagers is hard to find. And so there's an article that talks about the fact that we have a mental health crisis, actually among all ages, but especially among African Americans, and especially it's gotten worse because of the pandemic and the shutdown. And that has affected us more so than other ethnic groups, including the Latino Hispanic group, but especially the African American group. Anyway, I just wanted to share, open that arena. And we talk about mental health a lot. We talk about exercise also, but I don't think we can overemphasize the importance of that. Any of you smoke in this group?
Depends on which. Depends on what kind of smoke you talk about.
Smoking cigarettes?
No.
Okay, because they are talking about those people who quit smoking cigarettes before 40 can recuperate, their lungs can recuperate faster. Oh. Those who continue to smoke after that are less able to survive.
Wow.
Okay, well, those are the two things. There's an article about empathy, but I think we've got John's got a session that deals with that. So why don't you start the roll, John Buchanan, please.
Hey, Dr. Callender, I saw an article where they were saying those who, I guess, recover from COVID-19 have worse lungs than those who smoke?
We're going to talk about it. That's one of the articles.
Oh, okay.
All right. That's accurate. That's an interesting title for the article. But anyway, this is an article on 5 foods that are as good as, is Darryl around? Anyway,
he's there.
5 foods. And when I think about eating well, I think about Darryl, and exercising. Think about Darryl. But anyway, this is a good article that talks about 5 foods that are as good as medicine, and they identify why eating healthy is so important. And fiber, they say, is one of the most important things. And when we talk about high fiber, what do you think we mean when we talk about high fiber?
Vegetables?
Well, complex carbohydrates, and probably the easiest source of fiber is fruits. People don't eat enough servings of fruits.
Wow.
Yeah. Okay. Right. And vegetables as well, but fruits are automatic.
Oh.
It's amazing how few people recognize what he just said is true.
Dr. Callender, the high fiber seems like it works well with the small intestine as far as getting rid of bacteria.
Yeah. What about the thing that you take bacteria? What's the name of it? That is supposed to help too, because it helps.
Probiotics.
Probiotics.
Inflammatory bowel disease?
No, probiotics.
That's it. Yeah, probiotics. Yeah, because it helps the good bacteria grow and the bad bacteria decrease. Any comment about that, Darryl?
Yeah, here's a simple test to figure out if you're getting enough fiber in your diet. If you're not eliminating at least twice a day, you're not getting enough fiber in your diet.
Oh my.
3 times a day, That's ideal. Kids do it right. They eat and they go. If you're not doing the same thing as an adult, not enough fiber.
Oh, wow.
Good rule, good rule. Because there have been many studies that confirm the importance of regularity, and lack of regularity predisposes you to colonic cancer. So
Ooh,
going regularly is important. Then it talks about honey. Let's see. Buchanan as a honey advocate as of recent, right?
I switched, I just bought a 5-pound bag of sugar. And
Hey,
I'm not
hey,
using
Darryl,
any
what do you
of
think
it.
about that, man? Went back from honey to sugar.
No. I said I had just bought a 5-pound bag of sugar when I switched to honey, and I have not touched that bag of sugar.
Oh, good.
Oh, okay. All right.
Honey's not as bad as just straight sucrose, beet sugar, but it puts a heavy load on your blood sugar levels. When your blood sugar levels when they spike, and then you get the sugar low immediately following, you just put your blood sugar on a roller coaster. And not only that, primary cause of aging is sugar, either from honey or sugar. You look at cultures where they maintain tight skin, youthful looks. It's very little honey in those, very little sugar in those cultures.
Right.
Particularly Africans. There's not a lot of sugar in most underdeveloped African countries. They're flooding a lot of snacks, a lot of candy, sugar. They're putting in more metropolitan areas of Africa. But, number one cause of aging, sugar.
Oh my gosh.
There's a lot of data that supports that. The next thing to talk about is something that talk about peppers. And I don't know how many of you use pepper.
I use red pepper, ground red pepper every day for lunch and dinner.
Well, it's
Yeah.
very healthy.
Hot, very hot. Yeah.
How do you incorporate it in your diet?
I'm sorry, what is that?
How do you incorporate it in your diet?
Oh, well, I made my vegetables and everything, I had to have that. I'm from India. I don't eat bland food.
So you put it on, what do you put it on?
Everything. We cook it with vegetables, meats, eggs, everything, rice, even rice.
Everything.
We put
Wow.
I can eat just rice with red pepper and a little bit of sesame oil. That's my dinner.
There are no bad peppers unless you take jalapenos and you soak them in brine, and so you're getting the salt content. But all black pepper, red pepper, cayenne, it's all good. Reduces blood pressure. The article says, all the good things it does, pain relief. So peppers are wonderful.
Yeah. And people made fun of me in high school. I was bullied. They said, look at Maya. Look, she's eating that red pepper and chicken, vegetables. And they all used to laugh at me. I was made fun of in school all my life, college, school, at workplaces, because of my eating habits.
Isn't that interesting how anybody who's different is discriminated against? Doesn't matter for what.
And I cried and cried. I had no friends in high school, college, because everybody used to keep away from me. Ew, she smelled like curry something, they used to say. In those days, in 60s, 1960s, America.
Yeah. There's an article, there's a book put out by this lady from India who said the same thing. She said she came over from the United States at the age of 12, and she had so much bullying in school that she went back to India.
Oh, yeah.
Which is
That's not funny. I should not have laughed. Just the prevalence of bullying in the United States it could be the most bullied country ever.
Like our ex-president. No?
Yeah, exactly.
And they used to make fun. These Indian people smell curry. Ew, they're nice people. And these were adults and in late 70s and 80s in the gym
Look
and
at
all
what,
that. I used to hide from them when I used to, had to put my clothes on in the locker room because I was so, oh my God, I went through a lot in this country.
what about people from Africa? Remember, I remember how you say, oh, they stink because they didn't
Oh,
put on
yeah.
cologne.
Yeah.
Oh, yeah.
Well, sometimes they did.
Oh, no, not sometimes, often,
Body odor.
but
Yeah.
still,
They-
yeah, because they didn't do like we did, but they were different though.
Yeah.
Yeah.
No.
I think that we stink because of our cologne.
Thank you. Thank you.
Well,
Thank
that's
you.
the case.
Yeah,
Some people are
yeah,
allergic to
yeah.
those colognes. Some people are allergic to those colognes and they cause problems,
Yeah.
especially on elevators.
Yeah, especially when you apply it with a plant sprayer.
Yeah, okay. All right, the next one is tea. And what's interesting about green tea is that it is thought to be so good for you, But green, black, and other teas. Any comment about that, Darryl?
Oh yeah, green tea is good. Yeah, it's a little bit of a what do you call it? Things that make you lose water.
Caffeine?
No. Diuretic.
Diuretics?
It has
Yeah,
a diuretic effect.
yeah, it does. Yeah.
So
It
if
does not have
you're
caffeine in
prone
it.
to that, or it's like timing. Anything with a diuretic effect. If you want to sleep through the night, don't take it before you go to bed. Take it in the morning.
Okay. And then I think most of us are aware about tea. I don't know how many people are aware about apple cider vinegar, which is, I don't know, how many sources of apple cider how many of you take apple cider other than New Year's Eve? So,
Me.
Me,
Mhm.
I do. I do.
yeah, and it just talks about how good it is at lowering the cholesterol, etc. An apple a day. Remember they used to say an apple a day keeps the doctor away?
Yeah.
Yeah.
Yeah. Well, anyway, I thought this would be a good article to talk about because proper nutrition is so important. Next one. Now, yeah, okay, I have a bias towards nutrition and exercise. And the title of this article is interesting. No limit to cardiovascular benefits of exercise. So it suggests that the more exercise you do, the longer you live. And it did studies. Here's the problem with this. What's the problem with this study, Darryl?
I don't know.
The problem is it's all white people, as are most of the papers that we talk about. They talk about it's in the UK, so they're going to say that it applies to everyone. Well, maybe it does, maybe it doesn't, but many of the studies, and I think Darryl talked about it before, are biased in the sense that they have not included as many Black people and as many women as they should. And as a consequence, there is that bias, but be that as it may, it does demonstrate once again that the more exercise you do, the more you live. And the more vigorous the exercise, the better off you are. And it still talks about no less than 150 minutes a week, which is the minimum that is required for exercise. 30 minutes a day, 5 days a week is the minimum.
That's also relating the countries that they walk everywhere and et cetera, no automobiles, they don't have to worry about because they're getting their exercise by
Absolutely.
just doing manual work and planting gardens and walking everywhere. They're not concerned about buying all this equipment of us in our sedentary. And they said even women that did housework and doing heavy lifting or manual stuff, you're better off than what we're just doing sitting around and letting someone else do your work for you. Even washing clothes has made it less, because when we had to wash clothes and bend over and wring them out and all that and hang them up on the line, we were far better than we were with washer and dryers. But I'm just saying this because I would die if I didn't have my washer and dryer.
You know, I
So
think
true, so
another
true.
example was like
Yeah.
when you look at the Olympics.
Where's my happy article, John? That's not supposed to be next, but anyway, this is, we'll go to that after this one. But this is a sad story that we know well now about this Black doctor who was asphyxiating from COVID while she was, and as she was dying, she talked about the fact that being Black was the reason why she was treated poorly, and that people should be more sensitive, and that's a picture of her. She's 52, and she talked about how the doctor refused to give her medicine. Although the thing that was different about her is that she also needed pain medicine, which is unusual with COVID, because pain medicine does many things. It also decreases the respiratory drive, but she had many other problems. But she talks about the pain. The pain is not really a critical part of COVID, but of course she also had sarcoidosis. But that attacks the lungs, and that's not associated with pain so much. So there's some unusual aspects of her care, in the sense that she needed pain medicine, which is very unusual for people with COVID. They usually get short of breath, and she was short of breath also. But the doctor was afraid to take care of her properly because she needed so much pain medicine. And so they now why she would be sent home because of that is where the issue begins.
Dr.
Dr. Callender.
Patient,
What is sarcoidosis?
I'm sorry?
What is sarcoidosis?
Okay, sarcoidosis is an autoimmune disease which affects a number of organs, including the lungs, the skin, the kidneys, and sometimes the heart and the eyes. But it's an autoimmune disease that is very common in Blacks, and especially Black women. So that is a disease, and the treatment of it is steroids. And which then predisposes you to many other problems, including infections.
Dr. Callender.
Yes.
One of my girlfriends that I brought up to the meeting, her son caught COVID, and he was in excruciating pain. And they didn't give him any medicine at all and sent him home. And he had three boys, little boys, and a wife that he had to separate from, and he suffered with his COVID.
Yeah.
Doctor, as a hospital patient, can you ask to see your chart?
Can you ask to see is your chart?
Yeah.
Okay.
Yeah. Yes.
Because this Dr. Moore, one of the things that she said is on her chart, they wrote that she was a difficult patient.
Oh, no.
That's code for saying, this person doesn't deserve, stay away from this patient. Don't give them the standard care because they're a difficult patient. It's the equivalent of saying the patient is a bitch or a bastard. And so,
well,
that's part of the reason why they discharged her early, and then she went to a new hospital. But, maybe that's something that if we're ever in the hospital, is that something we should, look for our chart? If we see that on our chart, we know we're in trouble, or get an advocate.
Well, it is your chart, so you have the right to make a change in the chart or indicate your disagreement with it. Or so I don't know how that's going to help you, though, because you're right, though, that label follows you, and it's a problem. And for example, people who have sickle cell disease who need pain medicine, they have the biggest problem, because they have difficulty getting pain medicine because they're labeled as addicts, and that alcohol, of course, is a disease that is particularly associated with people who are Black. So sarcoidosis, but the association of pain with COVID does cause problems for people who have COVID, because people these days are afraid to give pain medicine. And so that makes it even more complicated.
Um,
Yeah.
I would like to say something. When I was in the hospital this past time, I was treated as a difficult patient too. And it's all because I was intubated and I had mitts on when I woke up. And I asked them, why did I have mitts on? And I was trying to tell them to take the mitts off, that I would not pull out the tubing. And oh, they treated me bad. They yanked my leg, the leg that was of concern in surgery. And then they, she was suctioning me, was jigging in my mouth like that. And I was trying to tell them to stop and that it was hurting. And they labeled me as a bad patient.
Oh my gosh.
And
Well, that is not uncommon, because when you have the tube in your mouth, you can't talk and you can't express anything to people. And so
I told one of the interns, give me some paper and pen. And I wrote, I will not pull out the tube, take off the mitts.
yeah, that's what.
But I was treated badly when I was coming to. Yes.
And that is one of the most difficult periods in when you can't talk and you can't tell people what you want them to do. And that is one of the times when it's associated with many situations in which the patients are very unhappy because of exactly what you mentioned.
Berlin, were you in MICU?
I was in surgical intensive care.
Okay, because I worked in MICU there, and those nurses are excellent.
Well, the nurse that I had, they claimed she was excellent, but what she was doing was not excellent to me. And I was trying to express to them that take the mitts off. I needed to pull myself up. After she was doing all that to me, I told them I didn't want her to work with me. And they were telling me, oh, she's a good nurse. You need to stop that. We need to clean you up. And why are you acting like, they just treated me so bad. They treated me really bad.
Sorry.
It's systemic racism.
Yeah, one of the aides.
I don't think it has anything to do with racism. It has to do with the inability of the patient to express themselves and to tell them what's going on. And people don't understand that as they should. And it requires a special sensitivity to the unconscious patient.
And sometimes I think it goes to training as well. And I know when I was doing an internship in rehab in my program, we would simulate, or they would simulate different situations for us, so that it made us experience as close as possible to what a patient might be experiencing, so that we get a better sensitivity and better understanding, which I think helps a lot, and it's often not present in training programs.
Yeah, that's a good point. Excellent point. Excellent.
But hospitals they always had the patient's rights and etc. But if you ask to see your records, a lot of times nurses, they know it because they got to check with your doctor if you could see it, or they keep it private. It used to be before privacy, where your chart was right at the foot of your bed and you can look at it. But now you can't see it. They hide it. And it's just like going to a restaurant. You get bad service. You don't want to complain until you leave, because they'll spit in your food. You can't complain about a nurse, because they're going to continue treating you bad unless they're going to have a fit and say you want to be on a different floor or something. How do the hospital actually handle these nurses or who's ever healthcare that's handling you? How do you get your patient rights?
You have the right to see your chart. That's all right. The reason why the chart is no longer at the bedside is because of HIPAA. HIPAA requires that everything is confidential, and that's the reason, to protect you. That's why, but it is your chart, and if you wanted to see something on the chart, you have the right to see it.
The
Well,
problem is reading.
I had no rights. I asked to be taken off the ventilator, and they would not take me off the ventilator. I told them I could breathe. They would not take me off the ventilator.
They
I
shouldn't.
stayed on
They
it 2
shouldn't.
days
They
after
should
I
not.
asked them
Yeah,
to.
exactly.
Just because you ask them doesn't mean they should take you off the ventilator.
Why
You
not?
do
I
not
was
determine,
breathing.
because you do not determine when it is safe to be taken off the ventilator. That's not your right as a patient.
Well, they weren't testing me with the ventilator to see if I could breathe.
That's not, anyway, as a nurse, you should know that there are certain tests that we do to identify
Right.
when it is safe to take you off a ventilator and when it is not. And that's
They-
not a decision that you make. That's the
Right.
decision that the doctor makes.
Yeah.
Well, one of the doctors listened to me and he did started the test and he saw that my breathing was good and they took me off the ventilator.
Okay, but what I'm saying is that it's not your determination. It's the doctor's determination.
But I could breathe though.
Yeah, it's the doctor's determination. So don't hold that against them. That's to save your life. If every patient who said they could breathe, they took off the respirator, many of them would die.
Right.
Because they don't have the objective parameters that the healthcare team has. So I understand how you felt, but your doctor is supposed to make that decision about when it is safe to take you off the respirator.
I hope I don't get.
Just because you want to come off is not really a reason for them to take you off the ventilator.
But okay.
Just to add a little levity, you're lucky if you can read the chart once you get it. You know how doctors write.
That's so true. Very true.
Yeah, she's so right. But there are those who read the chart and decided they wanted to put an addition to it to say that I don't agree with what the doctor said about me because so forth and so on.
So charts are still handwritten instead of digital?
No, most charts now are digital. There are areas in the country where it's not digital, but most places are digital.
Yeah, Dr. Callender, I was in the hospital the other day, and when I was in his room. I wasn't actually in the hospital. I was in his office, and he had a tag-along nurse with a computer and a roll-in computer. And so while he discussed stuff with me, she was there typing right on that computer.
It's a scribe. They call it a scribe, and many hospitals now are trying to adopt that because of the insensitivity that was evident when doctors had to be typing all the time and not looking at the patient. So one of the remedies, as we talked about this sometime before, is to have a scribe in which that person does the typing and the doctor interacts with the patient, which is the best way to do it.
Yeah, I was in the office on Monday with Dr. Metwali, and he comes in all the time with his rolling computer talks while he's doing his typing and stuff. So he's pretty good at that.
Well, this is another article on Biden, who has his own health agenda. Time will tell. Of course, the masking challenge that he issued is interesting, just the antithesis of what the past president had done. So it's interesting. He's got a COVID-19 response coordinator who reports directly to the president. It's going to be interesting to see whether his bold desire to have 100 million people vaccinated in 100 days will come to pass. But it's going to be interesting to see what happens. Also, he's also now trying to reinstate all of the damage that was done to the World Health Organization as a consequence of Trump. And so it's very interesting to see what happens with from this point going forward. Any comments?
Well, they found that the availability or the stockpile of the vaccine isn't what they initially thought.
Right, and so it's going to be interesting to see how this plays into the promise of 100 million.
Dr. Callender, when they give you a vaccine, of course, President Biden is saying that he's going to give so many vaccines in 100 days or whatever it is.
Right, 100 million.
Does that have anything to do with your second vaccine? Once you get the first one, is the second one set aside for you, or do they
Yes.
continue to use it?
Yes, set aside for you. Right.
Dr. Callender, I have heard that in some cases, people don't need that second dose.
That's not true. It is clear that the first dose gives you 52% and the second dose gives you 95%. Which would you rather have?
Yep.
95.
Right. Okay. So, by the way, since there's some people here who weren't here before, I'll just say again, if anybody wants to be vaccinated who's not vaccinated, if they would email me, I could send them the link by which they could become vaccinated. They would have to indicate that I'm their doctor, though, because this is for Howard University doctors. So if anyone out there is interested, my email address is ccallender@howard.edu. I put it on the chat, but any of you who came in late who were not here when I made that announcement, please take note.
Yeah, most of the information
What is your
is
first
in the
name?
chat. Most of the information is in the chat. And later on, I'm going to even add the link for you, Dr. Callender.
Okay.
Dr. Callender, I'm hearing mixed messages regarding the aspirin, taking the aspirin before the shot.
Tylenol.
Take Tylenol?
Not aspirin.
Okay.
Yeah, the problem with aspirin, it causes it depletes the platelets, and it may cause you to have more bleeding. So the safest thing is Tylenol, not aspirin.
Okay.
Especially if you're on bleeding medicine. You know, people who are taking blood thinners, then aspirin is not as safe as Tylenol. And one of the things is, when you take the vaccination, the first dose is not as associated with side effects as is the second dose. Although the first dose will have some pain under the site and slight headache and some other minor side effects. But the second dose, much of it is intensified. So when you get the second dose, it's important that you also take the Tylenol right after you get the injection. And then if you have any side effects, you take another Tylenol every 6 hours or so. And that will help you with the side effects.
Has anyone on here taken it yet?
Yeah, I've had both doses.
Oh, good.
Dr. Callender,
Yes.
good morning. Will you repeat your email address, please?
It's in the
chat.
It's in the chat, but
I didn't see it in the chat. I just went to the chat.
Oh, really? Okay, CCALLENDER@howard.edu. It's still there, but anyway, ccallender@howard.edu. Calendar is spelled with ER, not AR.
I have it. I just don't see it in my chat. I don't know why.
You got to scroll up your chat. Scroll
It's
up.
at the top.
and
It's
your
at the
chat.
top.
It's at the top.
But anyway, so I look forward to you emailing me, and I'll send you the.
Okay, thank you.
Okay.
You have
I
to
just
write
posted it again.
HOWARD, doctor.
I'm sorry?
You have to put at HOWARD.
Yes.
Howard.
Yes. Howard,
Okay.
yes.
John put it in the chat one more time. He put it there again. Ignore the capital letters because it can go with all small letters. It can go with all capital. But it's in the chat one more time.
So you got a double C in there, is that true?
Yes.
Very beginning.
Oh, okay, CC.
Right.
ALL, okay.
And don't forget, you got to be 65 and older.
unless you have underlying diseases, and many of you have hypertension or diabetes, and so you qualify. Not to speak of Perlene, who qualifies for a number of reasons. If you have end-stage renal disease, of course, you qualify.
Well,
Now,
they're offering it at the dialysis center, but they haven't gotten it yet, so we're waiting. I
okay,
signed up to take it.
okay. Okay, good. All right, any other questions? If not, this is a staggering figure, 400,000, huh?
Mm,
We leading the world in
a lot.
deaths from
Gosh, that's horrible.
COVID by far. And I think the next close to us is under 100,000, I think. But we're really, it's embarrassing to some that the United States, the richest country in the world, has the more deaths from COVID virus than anybody else by far. And some people think it's the way that we responded to the crisis. It remains to be seen, but it may well be the way we responded to the crisis, and the percentage of people who refuse to wear masks and who consider it a badge of courage not to wear masks is maybe part of the problem.
Yeah, because it was also politicized.
Yes. And it got to the point where Republicans wouldn't wear masks and the Democrats wore masks. So and when you look at the people who took over the Congress, many of them were not wearing masks. So.
And it's the misinformation putting out there as far as the masks don't work, because they were saying, as far as like the takeover of the Capitol, none of them was wearing masks. And when they had Black Lives Matter rallies, most were wearing masks then. So it's just people being sensible.
Yeah, it's and we behaved very insensibly. But we're paying the price for it. And some places there are still people who don't believe that this is for real. But if you got 400,000 deaths, that's very for real. Yeah.
But they also have reported that people in these areas, they died, still denying that it was coronavirus.
Yeah.
Because they're just so adamantly that this is not a real disease. So they're saying that doctors are trying to trick them by saying that they have this disease and they die.
Yeah.
The lies of the last administration did not help.
Yeah.
Yeah. That's a nice way of putting it. Yeah. So.
Well, Trump is gone, but the social media lies continue.
Yeah. Yeah.
They shut down his Twitter feed.
That's his Twitter feed, but they're very active. I get shared messages and Facebook posts all the time from the right-wing crowd, and that's just as strong as ever.
Do they know who you are, Darryl?
See, there's a few black people that are right-wing, and they just keep on going. They don't care.
Right.
Yeah. I think I saw 5 or 6 at the Capitol.
That's right. Yeah.
One was arrested a couple days ago for involvement at the Capitol.
That's good. Good for him.
But my crazy folks are my fan base.
Ain't that something? No matter what side of the fence on, black people still get arrested.
Yeah. Okay. Well, how much of this do you think Trump has to do with?
Everything.
A lot, yeah.
Well, he's taking the blame. He's taking the blame, whether he likes it or not. And the role model he played as a non-mask wearing person was problematic until he got the disease itself, and then even after that. So, and his presidency will be tainted by that. Not to say that's the only thing that will change it, but okay. Any other comment about that? We've talked the negative aspect of it enough, I think. Next one. Now this is interesting because it talks about giving vaccines, and here again, this is a Norwegian article, and not too many of us in Norway rather. But they're giving elderly people who are near death COVID vaccinations, and some of them are already close to death, and whether they're having an adverse reaction to the drug or just dying is not quite clear. But anyway, this is an article that shows that they're giving it to all old people over 85, whether they are near death or not. So the question is, we aren't doing that here. In other words, if you have people who seem to be terminally ill, they are not giving it to those people. But this is an example of what they're doing in Norway. Now, this is something that I added because I don't know how many of us actually have plastic surgery to get face filled. But if you have facial fillers, that the side effect of a Moderna vaccine is that you get swelling of your face.
Ooh.
So, but that's only for those people who actually have face fillers. Do you know anybody who's ever had their face filled?
How you doing? I'm in the middle of a session.
Any of you know of anybody who had a face filled? Yeah.
Yeah, it's pretty popular and with some of the people that I know.
Okay, popular.
And, yeah, and as a matter of fact, many dermatologists are doing more than just medicine. They're going into the whole beauty side of it, and they do a lot of fillers and a lot of cosmetic kinds of things. So it's popular and it's expensive.
Is that Botox?
No, there's some other things, Juvederm, and there's some others that are actual fillers that they inject to reduce lines and wrinkles and that kind of stuff.
Well, it's just to I didn't realize that there were many people who did, but the fact that they had an article on this suggested to me that there are people who need to know that this is a side effect, and it's not thought to be permanent, but it is a side effect.
I heard that with the Zoom calls, a lot of, especially females, are becoming very concerned with how they look on the Zoom calls, and they're reaching out more towards that.
Okay, now these are mostly men or women?
Females.
Okay.
There is a feature on Zoom that says you can make your appearance better.
Right.
Kevin and I were looking at it earlier. He was saying it's not going to help me at all.
Okay. Okay, let's go to the next one since now there's Johnson & Johnson and AstraZeneca, which are right around the corner. The difference between those is that Johnson & Johnson is one shot only.
Oh, that's good.
Yeah, the others, AstraZeneca is still 2 shots, but Johnson & Johnson is 1 shot.
Yeah, what's the efficacy with Johnson & Johnson?
We don't know yet because I've seen figures on AstraZeneca, which is 70%, but I haven't seen figures on Johnson & Johnson yet. And it's going to be interesting to see. Neither of them have been approved yet by the FDA. And that's when we'll know the data on those.
Dr. Callender, didn't you tell us that the efficacy of the flu vaccine was only 60?
50 to 60%, that's correct.
50 to 60.
Mhm.
Yeah.
I think that works pretty good though for me. I
Yeah.
don't know.
Yeah, well, you're in that 60%. So, but I mean, the AstraZeneca was 70%.
Could they
Uh,
could they adapt that mRNA technology to the flu vaccine?
Yes.
that's going to be interesting. They haven't done it yet. They haven't, and as a matter of fact, Moderna is doing that as we speak, and that's going to be probably by the middle of this year. That's probably going to be. I've read that that's going to be one of the things that they're going to try to get FDA approval for, adapting the flu vaccine to the mRNA technology.
I see there's an article on the TV right now where they're talking about Florida, where they're having tourism, out of state
Yeah.
tourists coming in there and getting the vaccine shots.
Mhm.
And the
And I know
residents-
people that have done it. This
Yeah.
is very easy to do. They get it, leave, come back and get the next one. Not fair, but they do it.
Right.
Mm.
Yeah, this is the article that I think someone had mentioned before, that people who have COVID lung disease, that it's worse than the worst smokers' lungs, because it attacks the lungs, and the inflammatory process destroys a lot of the lung.
Mm.
And if you look at
Can
the
you recover
X-rays,
from that?
yeah, people have recovered from it, but they still have scars. And those people survive. As you know, they had a double lung transplant for someone whose lungs were so destroyed. A successful lung transplant. But just to point out how devastating this can be to the lung. Of course, the many faces of COVID are evident many other places, because toes, remember we talk about the toes, talk about the central nervous system and the brain and other things.
Mhm.
And some people are wondering if some of Trump's mentality recently are related to his COVID brain disease, but that's a minority, because his manifestations of behavior were evident long before he got COVID. Anyway, this is a good example on the X-ray to see how normal lung looks and how the COVID lung looks.
Wow.
If you already have a lung disease, like sarcoidosis, asthma, will that make you more susceptible to having problems
Yes.
with the COVID?
Yes, that's another reason why you need to get the vaccine.
You need to take the vaccine.
Yes. Okay, the next one. Yeah. Yeah, this is interesting that Biden is taking the opposite position from Trump. There's another article that talks about the different kinds of masks, suggesting that the cloth masks are not as desirable as the filtered masks, and suggesting that people use more of the filtered mask than the cloth masks.
So that's the last article for today, Doc.
Now, I had an article that I sent you that talked about the value of positivity and how gratitude is very good for you. And I think one of the things that sometimes we don't realize, and the Bible says, is in giving that you receive. And so the importance of giving is important in the sense that it's in giving that you receive. Sometimes we forget that the act of giving is in itself a rewarding phenomenon. And this article talked about health, and talked about one of the most healthy things you can do is to be positive and to give of yourself. and the health implications of giving of yourself is very, very vast. And so when we think of love, and I think when I think of love, I think of Chaplain Phillip and how she demonstrates her love for mankind and for everybody else. And that loving is good, it's healthy, and giving is healthy. And the more we give, actually, the more we receive, because we're giving of ourselves, and that in itself is healthy, as is gratitude and appreciation for someone giving to you. And so the healthy aspects of exercise, nutrition, and of giving are things that are very helpful to keep in mind, that while we're giving to others, in many ways we're receiving ourselves, because we are actually giving that gift and putting love in action. Any other comments or any topics for discussion?
I'm Dr. Callender, and I was talking this over with my brother. Last time you were talking about washing your face after you wear the mask and going through all this stuff. And is there anybody on this panel is actually doing that? Because I found out it's hard to do.
What is hard to do?
Well, you wear the mask, and then after you take it off, you wash your face and you destroy the mask, or you keep that mask on after you go to the grocery store instead of taking it off in your car and washing your hands and all of this. And I'm just now beginning to wear my mask when I walk because it keeps me warm. And I'm trying to adhere to all these guidelines, but I'm finding it extremely hard.
Washing your face after the mask is done just to keep germs from your face, but washing your hands is absolutely imperative.
So that means you got to wash your face every time you take that mask off.
Well, as I was saying, washing your hands is much more important than washing your face. Washing your hands is more important because you take your hands and you put your hands everywhere, and you put the fomites, the virus everywhere. The impression is that when you have the mask on, the virus comes into the mask but doesn't get through it. And so therefore you would have some particles perhaps on the face. And so after you take the mask off, you could wash your face off.
You actually do this? Do you do
wash
that?
Wash your hands, yes.
Wash your
hands,
face.
yes. No,
I'm talking about your face.
No, I don't do that.
Okay, who does that?
Me. Well, yeah, we had a conversation about how difficult it was, and so it did change my process. Before I just kept my mask in the car, put it on before I stepped out of the car, came back to the car, took it off. Okay, now I keep my mask in a bathroom at home, and I wash my hands before I put on a mask. I've got a supply of masks, and so I can put on a fresh mask. I go out with the mask on. I come back home. First stop is like, say, if I bring in back groceries, of course, I'm going to put away the groceries, put the bag in the trash, come to the bathroom, wash my hands, take off the mask, wash my face, and I'm done. So, yeah, it was a big hassle at first, but now I guess I'm used to it.
I can't. Okay, I don't even know if I want to try.
Sounds good to me.
Well, certainly washing your hands is mandatory, because
I had a comment about that too, because using hand sanitizer and washing your hands a lot can make my hands so dry. So I put lotion. I have to put lotion on.
But lotion is good.
Take care of my hands.
I've got organic aloe lotion in 3 stations in the house, and so yeah, I wash my hands a lot, but I lotion up a lot too.
Yeah.
Let me ask a question, Dr. Callender. Once you get your 2 shots, your 2 vaccines, can you back down off of things like washing your hands for 20 seconds and all that?
No.
You can't back down off of anything?
No. Not until everybody else is Not until we have about 60% of the population vaccinated.
Yeah, that's the herd immunity.
Yeah.
Dr. Callender,
COVID is done, there's other stuff out there, and so good hygiene is always a good practice.
right.
Yeah, flu is still out there too.
Yes.
Dr. Callender, we've got some new guests on the line today. Dolores Saunders is here. Betsy is here. And I believe Stan Cornelius was here. And maybe they have a question.
And if they would identify themselves and tell us who they are, that would be great.
Well, I'm Dolores Saunders. I'm a DC resident. I've been in Howard University Hospital, and John and Carol invited me to attend, and the information that was sent to me has been very helpful, very informative. I have a 92-year-old mom that all I want to do is just make sure if I can stay healthy, she can stay healthy.
Thank you for joining us. We're so excited that you joined us. Thanks.
I'm glad to be here.
Okay. The others?
We have